This is an evaluation of the American Lung Association's Not on Tobacco program by Duncan McDonald. With 87% of adult smokers starting before the age of 18, developing an effective youth tobacco cessation program is a necessary step in combating smoking and the debilities associated with it. The American Lung Association, or ALA's Not on Tobacco program consists of 10 50-minute sessions conducted once per week. These sessions are usually held within school hours and are developmentally appropriate for high school students with teen-friendly language. Group sizes are 10 to 12 students and cover topics including stress management, effects of smoking, peer pressure, and healthy lifestyles. The Not on Tobacco program is most widely used smoking cessation program across the U.S., with over a decade of supporting research. Participants within the program are high school students ages 14 to 19 who are current smokers. The goal is to recruit youth that are addicted to nicotine, predominantly daily smokers, and all participation is completely voluntary. No specific demographics are target of these interventions, with rural, urban, and suburban communities selected. The Not on Tobacco program aims to significantly decrease youth smoking and reduce the number of cigarettes smoked per day by students unable to quit. It is also designed to improve stress management and other life skills and promote healthy behaviors including eating habits and exercise. The goal is to provide a program that can be disseminated across the U.S. and be effective in a variety of high school settings. Research is continuously being done to determine if the NOT program is an effective means of tobacco cessation among teens and if it is more effective than the current anti-tobacco programs offered in high schools. Geographic location and social views of tobacco play a large role in the effectiveness of the program. Lower smoking cessation and reduction rates were found in the South and Appalachian regions where smoking among adults is more prevalent. Smoking cessation was especially lowest among rural populations. With increased smoking among adults in these communities, children are more likely to grow up surrounded by people who smoke, including the adults they look up to. In tobacco-growing economies, there is a reduced stigmatization of youth smoking, seeing tobacco as a source of income and not a harmful drug. Governments in these regions spend less resources discouraging smoking both in education and tobacco regulation, leading to youth being misinformed about the impacts of tobacco use. Also, lack of government involvement is one of the reasons smoking habits haven't decreased at the rates they have in other regions in the country. Poverty is higher in these rural communities, and teens use smoking as a coping mechanism to relieve stress, hindering their attempts to quit. All these factors impact the effectiveness of the Not on Tobacco program. The American Lung Association developed the Not on Tobacco program specifically towards use by making the content developmentally appropriate and using language familiar to teens. Due to social pressure to fit in and the rapidly changing language and trends in high school students, the need to tailor the program specifically for the age group is strong. The NOT program content covers topics such as peer pressure, developing support networks, and the media, on top of the effects of smoking, preparing to quit, and addressing specific issues teens face in their social lives. The program is offered in a gender-specific setting with same-gender facilitators to address the differences in social perspectives among female and male students. Also, the program is voluntary and offered during school hours, giving it the feel of an educational experience and not impacting students' social lives outside of school. The short sessions ensure participants are able to keep attention throughout the class. Despite the not developers' attempts to create a program relevant to students ages 14 through 19, more could be done to incorporate the differences in perspectives across the country. Changes in the content could be made to meet the different social and cultural views depending on the geographic regions of the program is being conducted in, especially if communities where it has been less effective. These changes could account for tobacco-growing economies, favorable attitudes toward tobacco use, and lack of anti-tobacco resources. Given that the vast majority of smoking initiates before the age of 18, the Not on Tobacco program attempts to combat smoking within communities by addressing the issue prior to 18. People who start smoking at an earlier age develop more severe nicotine addiction than those who wait until later in life. There is evidence that this might be the most effective time to prevent smoking from becoming a health issue. The Not on Tobacco program promotes smoking cessation and reduction within use, as well as encouraging healthy lifestyle choices by providing a comprehensive plan to improve overall health within community youth. The key development players of the Not on Tobacco program are the West Virginia Prevention Research Center, or PRC, and the American Lung Association. Not on Tobacco was developed by the West Virginia PRC researchers Kimberly Horn and Jerry Dino as community-based teen smoking cessation program. After the initial trials, NOT was adapted by the American Lung Association as an effective method, and the ALA worked to coordinate the program into widespread use. The ALA developed a system to recruit and train facilitators to carry out the program, while the West Virginia PRC continued to conduct research on its effectiveness to ensure that the initial results were replicable among all demographics. The results of the NOT trials were then advertised on the ALA's website to further promote it as an effective program. Dissemination of this project was carried out by researchers and biostatisticians to develop and analyze the successfulness of NOT. The program was supported by healthcare administrators at the ALA in identifying its value, school health coordinators, teachers, and nurses and volunteers as project facilitators alongside the community health workers, supported NOT by promoting the involvement within schools and the community. All levels of government, community organizations, and coalitions have a vested interest in the health of school-aged children to reduce the effects of tobacco-related health debilities. These organizations play an important role in funding and implementation of Not on Tobacco programs within communities they represent. Government organizations and coalitions such as the West Virginia State Health and Education Department and the Coalition for a Tobacco-Free West Virginia also provide feedback for the program to ensure it is as effective as possible. Students learn cultural norms, including healthy lifestyle choices as well as academic skills in school. Therefore, school has the responsibility to combat unhealthy habits such as smoking. Additional stakeholders to the school include the Not on Tobacco program facilitators. These are the individuals who instruct the weekly in-school NOT classes. The facilitators are often teachers, school nurses, or administrators with interest in promoting healthy lifestyle choices for their students, but it can also be volunteers concerned about the health within the youth of their community. Students between the ages of 14 and 19 are also external stakeholders of the NOT program, with over 2/3 of teen smokers saying they would like to quit. Students are involved in the program because they are motivated to quit smoking and are seeking a practical method to do so. Lastly, the tobacco industry can be affected by the NOT program. The majority of adult smokers begin before the age of 18, so the widespread effective youth tobacco cessation program could severely impact the amount of cigarettes sold both immediately and in the future. Cooperation from many sectors of the community was necessary to implement the NOT program. State and local school systems had to agree to allow the program to run within their schools. Volunteers were necessary to donate their time for training and facilitating the program. Community support was also necessary to allow the allocation of funding to be placed towards tobacco cessation and parents allowing their kids to be taken out of class once a week to partake in the NOT program. The Not on Tobacco program was funded in schools from both grants and taxes. Organizations like the Centers for Disease Control and Prevention and the American Lung Association provided grants to schools to implement the program and researchers to conduct more research on the efficacy of Not on Tobacco. Costs for running the program were also paid by tax dollars in the form of state anti-tobacco initiatives and school systems allocating some of their funding to offer the NOT curriculum. Additionally, alternative funding was gathered by donations from individual donors, corporations, and foundations, allowing for greater implementation of NOT in schools.